My name is Cecilia Simpson, and this is the thorax and abdomen exam. Here's the patient's consent form. I would first begin this exam by closing the curtain for patient privacy and doing proper hand hygiene. Okay, my name is Cecilia, and I will be doing your exam today. Can you state your full name and date of birth?
Declare Vaco 100401.
Okay, can I see your wristband? Thank you. Do you have any health history relating to this exam, including smoking or having pneumonia?
Nope.
Okay, so from observation, I note that Nick is sitting upright and relaxed. His breathing is not being assisted by any accessory muscles, including the sternocleidomastoid or the trapezius. So I'm going to begin by starting with the posterior thorax. Could you go ahead and turn around for me? Is it okay if I touch your back?
Yeah.
Okay, so I note that Nick's scapula seem to be flat. The spine is straight and midline to the body. Okay, I'm going to go ahead and do your posterior to anterior ratio. Okay, so I note that the AP transverse ratio is 1 to 2. And then I'm going to go ahead and have you take one deep breath for me. Okay, so his chest is expanding symmetrically between 1 to 2 inches, and the ribs are sloping at a 45-degree angle. I'm now going to go ahead and listen to your breath sounds. Okay, so just take one deep breath with each placement of the stethoscope. Okay, could you raise your arm a little bit for me? And then go ahead and raise this arm. Okay, so I note that the breath sounds are clear and normal in the vesicular and bronchovesicular regions. Okay, you can go ahead and turn around this way for me. Okay, so when examining the anterior thorax, I note that the clavicles are equal and slightly protruding. The sternum is straight and flat. Okay, I'm going to go ahead and examine your breath sounds in the front. Okay, so take a deep breath with each placement of the stethoscope. Could you raise your arm for me? Then raise this arm. Okay, so I note that the breath sounds in the front are also clear with normal breathing in the bronchial, bronchovesicular, and vesicular regions. So now is the abdomen portion of the exam, so could you go ahead and lay down for me? Okay, I'm just going to go ahead and place this over for privacy. Okay, so to start the abdomen portion of the exam, I'll observe the contour at eye level. I note that it is flat and his skin appears to be an even beigeish throughout. There is no discolorations. All quadrants seem to be symmetrical with the umbilical central with no drainage or lesions. There is no striae or lesions within the abdominal area. Do you have any pain anywhere in your abdomen?
No.
Okay, so since the patient has no pain, we will begin in the right lower quadrant. If the patient were to have pain, we would start one quadrant over clockwise, making sure to examine that quadrant last. Okay, so is it okay if I go ahead and auscultate the abdominal area?
Yes.
Okay, just go ahead and breathe normal. Okay, so I know normal abdominal sounds occurring about every 5 to 15 seconds, which would indicate normal bowel activity. Is it okay if I palpate your abdomen?
Yes.
Do you feel any pain or tenderness when I do this?
No.
Okay, so the patient has no pain or tenderness in the abdominal area. Okay, so now I'm just going to go ahead and palpate the urinary bladder. Okay, so I don't feel any distension, meaning the urinary bladder is about empty, which is normal. So if you could go ahead and sit back up for me, I'm going to perform blunt percussion of the kidneys. Okay. Just go ahead and take a seat and then face that way. Okay, let me know if there's any pain or tenderness when I do this. Anything?
Nope.
Okay. Now for this side. Any pain or tenderness here?
Nope.
Okay, so at this point in the exam, I would replace the clothing and linens and reposition the patient for comfort. I would then make sure the call light is within reach, both bed rails are up, perform proper hand hygiene, and document my findings.